We're going to take a look at a post-pandemic surge in plastic surgery procedures, particularly in America. As states across the USA reopen, more and more people are opting to receive cosmetic procedures, everything from breast augmentation and rhinoplasty to Botox injections. Americans spent $9.3 billion on aesthetic procedures in 2020, up from $8.2 billion in 2019, this according to the Aesthetic Society. And experts say in 2021, even more money will be spent. So what's behind this boom? I'm delighted to welcome live from New York City, top plastic surgeon, Dr. Richard Westreich. Hi, Richard.
How you doing? Good evening.
Great to have you on the show. As people consider plastic surgery, you're very concerned that they approach it in the correct manner.
Absolutely. You know, as you alluded to with the increase in people interested in plastic surgery following the pandemic, there was what I like to call an expansion of the funnel with all the virtual consultations and ease of access for patients being able to get to doctors. And it became much easier to kind of streamline from inception to procedure. And these things actually happened even faster because people had very open schedules. I personally had many patients that I basically operated on without ever really meeting them in person before the day of surgery. So those type of situations can turn out great, but those type of situations can also turn out not so great. So I think we do need to have a little bit of caution in terms of our exuberance in moving forward with these things and make sure to keep our standards the same, which is what I tell my patients.
Now, of course, if you were in New York or in a nearby location, people would be wise to head to you, Doctor, for your expertise. You've got an amazing CV and a lot of pedigree when it comes to plastic surgery, but there are bad actors out there, aren't there?
Absolutely. The way it works in the United States is if you own your own office and you have your own operating room, then you are the person that determines whether or not you are capable of doing certain procedures, as opposed to if you work in a hospital, the hospital will actually decide if a physician can and cannot do a certain procedure. So because people are able to essentially do whatever they want in their own office, as long as they sort of self-certify, you do have to be careful about the people you choose, specifically also for the things that you choose to have them do.
Yes, so what's the procedure? If it was done correctly, which it's done on your watch, I went to see you, okay, so we have a face-to-face consultation. Let's imagine that, you know, we're out of social distancing. I can visit you at your clinic, and I'd like, I don't know, a bigger bum. What's the conversation, and what hoops do I need to jump through for that to happen?
Well, obviously the conversation needs to be about whether or not, first, you need a bigger bum. Second, the conversation would be about how we would go about doing that. And then third, we would have to work through the logistics. I don't have an operating room in my office, so I either operate in the hospital or in somebody else's office facility. And so I have a third party making a determination about whether or not I am fit to do a procedure. But let's assume I'm fit to do the procedure and you want to do it. So we go through the particulars of the cost and the aftercare and what to expect. Obviously, risks, benefit, those conversations should always happen. And then if all is well, we pick a date and we go and do it. So it can be a fairly quick process, you know, with either one or two visits with a physician, and then all of a sudden you're under the knife.
Do you ever make a judgment that a patient is pursuing plastic surgery for the wrong reasons? And what do you do under those circumstances, Doctor?
Absolutely. Fortunately, it's the minority of situations where people are looking for things that are not in their best interest. But they do come up. And I think it's a very challenging conversation, to be quite honest, because you have to find a way to tell them that they shouldn't do it without telling them that they have the wrong idea, if that makes sense. And usually the best way to do it is to sort of steer them in another direction. Or I like to use visuals a lot. So my patients get tons of photos taken, And so I will go through these photos on a large screen TV with the patients, and I'll point out, I just don't think this is relevant or necessary for you. And ultimately, if they're insistent and it's something that I don't feel comfortable doing, I simply just tell them I don't think I can be the surgeon they need. I can't get the result they're looking for, and bid them, good luck.
Is one difficulty with plastic surgery what I would call new sofa syndrome, doctor? In which, in your living room, in your lounge, you buy a new sofa and it makes the carpet look very old. You replace the carpet and then the wallpaper's a disaster. Does that happen with the human body?
Definitely. The face, for example, is a perfect microcosm of that. So, if you have one area that you're focused on and you get that one area taken care of, you may then look at the next area that you weren't paying so much attention to and wished you'd done something. So, when I see patients, I'm generally looking for balance. That's kind of my overall goal. So if you have one area that's really out of balance, then I think it's completely reasonable to focus on just that area. And then once you're done, you'll be in basically harmony. However, if you have multiple areas that need attention, my practice is basically to tell you about all of those. I'm not necessarily telling you to do everything at once, but as I always say to my patients, the difference between an explanation and an excuse is timing. So I'll tell them, I think, hey, we do this. You may want to consider this because it won't be imbalanced, but if you're not ready, we can certainly do it down the line. So that happens all the time, both with face and body work, but I think even more so on the face because you can kind of see it all in one visual field. So you have to be very cautious about telling people what's best for them, not necessarily always just doing what they ask for.
Of course, and managing expectations, I suppose. Do you see more
Definitely.
Women than men, doctor?
Yeah, it's a preponderance of females in my practice, although I do have a fairly robust, because I'm a facial surgeon, I do a lot of nose surgery. So I do have a lot of male nasal patients, for post-traumatic or breathing. But even with that component, it's probably about an 80-20. So it's really skewed.
Have social media influencers been good for business?
Interestingly, they've been great for business. That's one of the things, actually, that I think during the pandemic was a very large driver of people's interest in cosmetic surgery. Not only were they seeing people on social media going for procedures and posting about them, but they themselves were so much more heavily participating in their own social media. The sort of social media effect or Zoom effect drove a lot of people to kind of seek enhancements. So that's the first thing. And the second thing is, not only for me putting myself out on social media so patients can get a better idea of, what I'm like and what my personality is like, which I think is important. Also, there are these drivers on social media, these influencers, and I think the influencers had a great deal of power this last year during the pandemic, and it influenced a lot of people to seek some cosmetic enhancements.
And of course, Dr. Westreich, we're all on TV now, aren't we? Because Zoom meetings happen via a camera on your laptop. So we're all broadcasting, we can be heard and we can be seen. Is there a market for people that want to look better on Zoom?
I think that was kind of the first bubble during the pandemic, was the Zoom effect. Very early on, we got a lot of patients that were interested in jawline, chin procedures, submental if they had a little bit of fullness. There was a lot of people that came in with a great deal of interest in that, because that's kind of the one thing that really stands out on Zoom, especially if you have a camera that's not, at the best angle. So there were a lot of those procedures going on in the first 6 to 12 months of the pandemic. And frankly, they're still going on, but not necessarily to the same degree. So that's a huge effect that occurred from doing that.
Now, Richard, I think we've achieved a bond of trust. What work do I need done?
I think you're perfect as you are.
If you want, I can take my shirt off, but maybe I'll spare you that particular. It's interesting, isn't it? By the way, sure, Richard, I couldn't possibly afford your services. Tell me, does plastic surgery evolve as an art form and a skill? I mean, does it get better? Is it, is an eyebrow lift better now than it would have been 10 years ago?
Absolutely. There's different factors. I think anytime a procedure comes out, the technology is going to kind of drive that, but then the technology is going to improve. So a lot of procedures have been enhanced by improved instrumentation, improved techniques. Also, as people do the procedures more and more, they gain a greater understanding, and then they convey that to their colleagues. And procedures definitely get better and better over time. Like if you think about a facelift, for example, right? Facelifts in like the 1960s and 70s, were fairly horrible. And you could tell from the other side of the room, like, oh, that's what they had. But now they've evolved into a completely different animal where, the procedure is done very differently, and you can get a much more natural looking result that, if in good hands, really should not be noticeable to anybody, with any obvious, disfigurement or something.
Well, that's right, because we know that there are high-profile celebrities, Richard, that have got carried away and they've had too much plastic surgery. And that's not the fault of plastic surgery as a medical discipline or a genre, is it? That's just that they've either had too much or it was done by the wrong surgeon. The bottom line is the best plastic surgery is the plastic surgery you don't notice. They just look great.
Exactly. So, those celebrities, I think...
Yeah.
Sorry?
Yeah, no, go on.
No, I was saying they're the victim of being celebrities. I actually think in many situations, celebrities don't get better treatment than non-celebrities. They actually get worse treatment because there's a lot of pressure on the providers when they ask for something to just do it. And so a lot of them get overdone.
Yeah, no, that's a fair point. Richard, can you take me through the logistics of it? So you're an expert in facial plastic surgery, and I'm sure lots of people come to you with bags under their eyes. Why do we get bags under our eyes, and what is the process by which you eradicate them?
So there's a couple different pathways in which you can get bags. So all bags are not created equally. Some people have bags, and this would typically be younger patients, where the tissue that's kind of holding the fat around the eyeball inside the eye socket is just a little weak. And so it begins to bulge out, and the fat begins to what's called pseudo-herniate outwards and creates the bag. Then there are other patients where not on the eyelid, but just below the eyelid on the upper cheek, they're sort of missing a fat pad. And that fat pad creates fullness, and when it's absent, you get a hollow. And when you get a hollow, the hollow creates the bag. So the bag isn't even real, it's secondary to the hollow. And then as we age, typically both of those things happen. So some patients need fat reduction, say the younger ones. Other patients actually need volume addition into the hollow. And a lot of patients, especially older patients, need a little bit of both. So there are 3 or 4 different procedures that you can do that you should tailor to the exact situation, because as I said, all bags are not created equally.
I've always been fascinated by liposuction, which is quite literally sucking the fat out of someone's skin. Does liposuction happen in the face as well? Can you remove fat from the face? Do you?
Very little. Sometimes you'll do a little bit of liposuction, say along the jawline if somebody has what's called jowling, where they have something that's kind of hanging down. But generally, think about fillers. We spend billions of dollars every year trying to refill everybody's face. So you don't want to be taking a lot of volume out, because then you're basically taking a grape and turning it into a raisin. So very selectively on the face, but a lot of liposuction can be done in the under jaw area or the submental region, which is pretty standard.
And is liposuction, whether it's under the chin or of course around the belly, the thighs, does liposuction work?
It does. Some people think of it as kind of like a weight loss strategy, but it's not. It doesn't work for that. The best way to think about it is to just change the shape. Fat actually doesn't weigh very much, which is ironic, because every time we think about somebody who's overweight, we think of them as fat, but it's one of the lighter tissues in the body. So you can take out a lot of fat, and the patient will only lose 4 or 5 pounds. But what you've done is dramatically change their shape. And the way the body works is that you kind of have a finite number of fat cells, and you won't make new ones until the ones you have are full. So liposuction will work because you'll have less fat cells in the area that sort of causes visual problems. And if you gain weight, it's not going to go right back there. It's still going to go kind of globally. So it does work in that way, but it's not a weight loss strategy. And obviously patients have to kind of maintain things afterward, or it's kind of for nothing.
I might, full disclosure, disappear from the national airwaves next year, and I might just be in New York for 2 weeks, and I might return home to London heavily bandaged, and I might have visited you. Do you have a website?
I do. It's New Face New York.
And clearly that's going to be a very well-visited website in the weeks and months to come as we emerge from the pandemic. Richard, thank you so much for joining us live from New York City. Dr. Richard Westreich, who is a top plastic surgeon, who makes a very clear point that if you are considering any procedure like that, that first of all, you consult your GP, and secondly, that you make sure that anybody you go to see is fully certified. Inform yourself, lots of online resources, but the NHS is definitely the best port of call.